Hello students, welcome to the second video lecture for healthcare ethics. So I'm going to start the lecture with a bit of business regarding the course and then move on to the content. So first of all, good job everyone on the midterm. Well done. I will be sending out scans of your graded exams on Tuesday. I encourage you to use these to study for the final. So you can see what you got right, what you got wrong. I'll explain the grade breakdown when I send out the email. But I want to make sure, because this was a thing that came up a lot on the midterm, that you guys bear in mind appropriate citation practices. I know, they're complicated and boring and blah, 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 but the most important part is that you put the words of others in quotation marks, okay? This is a sort of like fundamental baseline of intellectual property. So please, please, please use quotation marks whenever you use someone else's words. So like anything more than a single word from someone else's text, and even sometimes a single word, if you're taking it from one of the articles that we've read and including it in your answer, put it in quotation marks, okay? Citations appear after the quotation. We talked a lot about paraphrase when we were back in the real world, and I had you do that citation worksheet, and you're gonna have to do another piece of paraphrase work on the worksheet for this week. Paraphrase means substantially changing the words. So you're saying the same thing that's in the text in your own words, and you still need to cite it when you paraphrase something. So citations would come at the end of the sentence when you paraphrase it. But the distinction between the two, between paraphrase and quotation, is that you put quotations in quotation marks and paraphrase you don't. Okay? I know that's a pretty basic distinction, but it's one that I saw a lot of confusion about on the midterm, so I wanted to make sure that everyone is on the same page. So you're going to have to do citation again on the final. The final exam is going to be roughly the same format, but it's going to have fewer questions. You'll have to write a bit more for each one, and you're also going to have a longer time to do it in. So the final exam will be due on May 22nd, and you'll have 48 hours to complete it instead of 3, like the last exam. So hopefully that'll work out a bit better for people in terms of access, and also in terms of thinking through the things that you write. So there is also one more written assignment for this course. So this is besides the worksheets that we are doing in substitution for our classwork. You guys still have to complete this written assignment that was on the syllabus from the get-go. And the assignment is for you to write an op-ed, so an opinion editorial piece of the sort that gets published in newspapers all the time. And you're going to be writing one about a specific topic in healthcare ethics. This assignment seems actually really appropriate now, as there is a ton of news coverage on coronavirus, and healthcare ethics is actually in the news a fair amount. So you're going to be writing the sort of piece that you might be seeing in the New York news media, and the assignment sheet is also going to ask you, so what you're going to be doing in the worksheet for next week is dealing with the finding an example of a contemporary news media piece that is related to this topic. So we'll talk more about that next week. I'll put up the assignment sheet this week so you can have a look at it before you have to encounter it. And the op-ed assignment is due on May 15th. So you actually have a fairly long time. You've got about a month to figure this out. But I want you guys to start thinking about it early so that you can put together something really good, something that you would be proud of publishing even. Okay, so I'll post a detailed assignment sheet to Blackboard, talk more about it in lecture next week, and if you have questions or concerns, you can email me. Okay, so to the subject of our lecture for today. We're going to be talking about the ethics of quarantine. A very timely subject. I had you guys read two pieces for today. One is a piece that was published in the Yale Journal of Biology and Medicine, written by Martin Cetron and Julius Landwirth. It's entitled Public Health and Ethical Considerations in Planning for Quarantine. And this was published in 2005, so 15 years ago. So we're going to think a little bit about that time gap in the lecture today. And I also had you read an excerpt from Michel Foucault's book, Discipline and Punish. So this is a book that was originally written in 1975. It was written in French, and you're reading an English translation. And Foucault looks a little bit different from the readings we've had thus far, and we're going to talk about why as we get into the text. But what you guys read was the opening pages from the chapter on Panopticism. Panopticism is not really a word that you guys totally have to worry about for the sake of this course, but it's basically an idea about surveillance. So pan in Panopticism is all, like pandemic, and optic, like the optic nerve, like optician is vision. So panopticism is the seeing of everything. Okay, but before we get to Foucault, we're going to talk about Cetron and Landwirth. So I want you guys to note that there is a really good set of definitions at the beginning of the article. And you're going to have to refer to these definitions on your worksheet, but I'm not going to go over them here. So that's something you're going to have to digest on your own. Instead of defining quarantine in this lecture, we're going to examine the ethics of quarantine as discussed by these authors. So I'm going to start by directing your attention to a quotation on page 328. So I'm going to ask you guys to pull out your text, and what you're going to see, what these authors do a lot, is reference other texts. This is a thing we've encountered before, but you know that they're quoting someone else because they put that language indented in a block quote. It's not a strategy you guys should be using. It's not one that's appropriate to the kind of citation we're doing in this class because you're not really writing the sort of essays that call for long quotes. Instead, you should be focusing on shorter quotes which belong in the body of the paragraph in quotation marks. Regardless, what they do is they use a lot of block quotes, and we're going to be looking at one to start, which is on page 328. It's the second block quote on the left-hand side of the page, and it's from another article by Smith et al. And I'm going to read it for you. So, the individual fear and community panic associated with infectious diseases often leads to rapid, emotionally driven decision-making about public health policies needed to protect the community that may be in conflict with current bioethical principles regarding the care of individual patients. So I'm going to read that last bit to you again. So public health policies evoked by emotion that may be in conflict with current bioethical principles regarding the care of individual patients. Okay, so what they're drawing our attention to here is a conflict that sort of animates the entire essay. And it's a conflict between fundamental principles that we've been studying already in biomedical ethics and the bigger picture idea of public health. So they, in this quote, I started with this quote because I wanted us to think a little bit about this question of fear and panic that is going to show up again when we get to Foucault, and I think is showing up a lot in contemporary news media coverage of the coronavirus coronavirus pandemic, excuse me. But what I want to draw our attention to for the purpose of this class is the idea that public health policies needed to protect the community may be in conflict with current bioethical principles. So the bioethical principles that we have focused on thus far, autonomy, non-maleficence, beneficence, and justice, are primarily principles that concern the individual patient. So perhaps with the exception of justice, all of these things are about the relationship between the healthcare provider and the patient. So autonomy is the most fundamental of these, and it is about individual patient autonomy. It's about the individual patient's ability to choose and make healthcare decisions. Non-maleficence is about the duty to do no harm. Do no harm to whom? Do no harm to the individual patient. Beneficence, the flip side of that, is the duty to do good to the individual patient, right? So we've been thinking a lot about doctor-patient or provider-patient relationships. So healthcare as something that occurs on an individual level. We've talked a little bit about systemic concerns in regard to justice, and we're going to talk a lot more about those systemic concerns next week. But what we're interested in here is the conflict between the individual, the autonomous individual, and the larger public health system. So Cetron and Landwirth argue that quarantine creates an ethical conflict between autonomy and community. So if you guys look on page 327, I'm going to read you a long quote, and this is the words of Cetron and Landwirth here, so they're not quoting anybody else. And they write, this is the bottom right-hand paragraph. Although the discipline of public health has its origins several centuries ago, it is only relatively recently that ethical principles and codes to guide public health practice and policy have been formulated. So public health is really old, according to these guys. It's actually older than medical ethics, perhaps. The ethical principles at the heart of more fully developed fields of medical and research ethics, they go on to say, these principles are grounded in the primacy of individual autonomy in clinical decision-making, in the therapeutic setting, so this we've talked a lot about, individual autonomy in clinical decision-making, and they're also grounded in consent for participation in the setting of human subjects research. So we haven't talked all that much about research ethics, but we have talked about informed consent in clinical decision-making, and consent for participation in research ethics looks a lot like informed consent in the situation of healthcare decision-making. So the ethical principles at the heart of these fields are grounded in the primacy of individual autonomy. These principles are guided by a fundamental moral axiom that individual persons are valued as ends in themselves and should never be used merely as means to another's ends. Public health, on the other hand, emphasizes collective action for the good of the community. So that's the end of the paragraph. What they don't say there, so you see there are sort of two different terms in how they're articulating this. And what they don't say there, public health emphasizes collective action for the good of the community, can look a lot like individual persons not being valued as ends in and of themselves, but rather being valued as members of a community, and can look a lot like individual persons being used merely as means to another's ends. The tricky thing here is that it's not you versus me. It's not an individual being used as means to another individual's ends, but rather an individual being used as the means to an end, multiple individuals, lots of individuals being used as a means to a larger collective end. A collective end that is understood to contain those individuals, right? So it's the idea of the tension between the individual and society. This tension is at the heart of the conflict that they identify in their article, and the conflict that is sort of the basic fundamental conflict between biomedical ethics and public health. So if you guys turn to back to page 328, where we started, in the the first block quote there, this is a quote from the Public Health Leadership Society. They write in the middle of the quote, "There is no ethical principle that can provide a solution to this perennial tension in public health, that is, the tension between individual autonomy and community policy. There is no ethical principle that can provide a solution to this perennial tension in public health." So, somewhat surprisingly, this Public Health Leadership Society is admitting to an unresolvable ethical conflict that is the essence of their discipline. So, how do we resolve this conflict? Before we get to that, take like 2 seconds and look at the bottom of that block quote from the Public Health Leadership Society on page 328, first block quote on 328, and note what they mention at the end of the paragraph, the police powers of public health. So we're going to return to that when we get to Foucault. So just keep those police powers floating in the back of your mind. But how do we resolve this conflict? How do we resolve this perennial tension in public health? So another way of asking that is, what would an ethical or what would a bioethical quarantine look like? So the authors of the article that we're reading, Cetron and Landwirth, offer us the opinion of another author, whose name is Ross Upshur. This is the opposite side of that same page. And he gives 4 principles that can be used to justify quarantine. So, thus far in the course, we've been thinking about medical ethics as something that governs the behavior of individual healthcare providers. Here we're thinking about medical ethics as something that governs the behavior of institutions, governments, public health authorities, sort of larger scale structures of power. So if you're a public health official and you are thinking about instituting quarantine, Ross Upshur has some advice for you. He says, in order to make an ethical quarantine, so this is not about like what's ethical for me to do in quarantine now, or for a healthcare worker to do now under quarantine. This is like about what is ethical as a system that institutes quarantine. The first point is the principle of harm. So this is the idea that there must be clear scientific evidence to justify quarantine, that the potential harm caused by the disease is greater than the harm caused by quarantine, and that it is founded in that the decision to institute this quarantine is founded in scientific evidence. So there is no point, for example, in instituting a quarantine for cancer. Lots and lots of people die of cancer. But why don't we institute a quarantine? Well, wouldn't stop it, right? Cancer is not a communicable disease that quarantine can affect. That seems pretty obvious. It's also, according to this principle, not a good idea to institute a quarantine for the flu. Even though the flu is communicable in ways that we could stop by making everyone stay in their houses, the harm that we understand to be caused by the flu is not great enough to merit the enactment of quarantine. Okay, so the next principle that Upshur offers his public health official who's considering instituting quarantine is the idea that the quarantine must use the least restrictive means. So quarantine measures should try to respect individual autonomy, even though there is this perennial conflict. Quarantine measures should try to respect individual autonomy and be the least restrictive form of quarantine that they can possibly be. So this is how we ended up in this country with social distancing instead of true quarantine. So our public health officials understand that to be a less restrictive form of quarantine measure that permits some measure of individual autonomy. The third principle, and perhaps the most important that Upshur identifies, is reciprocity. So, according to this principle, the community has an obligation to, quote, provide necessary support services for those in quarantine, end quote. So, what does this mean? You can't just lock people up in their houses and not feed them to prevent the spread of disease. That would be unethical. So the more contemporary, more realistic version of this looks like stimulus checks from the federal government to compensate for loss of pay during COVID-19. So it reflects an ethical obligation to care for those affected by quarantine measures and to perform some measure of compensation for the loss of individual autonomy. So this is about community responsibility to those whose lives are affected by the quarantine. And the last point that Upshur raises is the idea of communication. So if you're going to be a good ethical public health official, you have an obligation to communicate the reasons for your actions to the public and to allow for appeal. So not only is it your obligation to be clear and communicate all of the quarantine orders, but you must also, in order to be ethical, allow the public to talk back, allow for appeal. So all of these are important points, but reciprocity seems like the most important one here. So this is the aspect of our current soft quarantine that the government officials are struggling with the most. And I think it's the one that addresses the heart of the ethical dilemma of public health. So the idea here is that I give up my autonomy for the good of the community, and in return, the community protects and sustains me. So the reciprocity at play here is something that can mediate that conflict between the individual and society. So this is kind of the fundamental idea of the social contract, which is, way back in the origins of philosophy. We'll talk a little bit about the history of philosophy in a minute. But as it applies specifically to the question of quarantine here, the idea is that I am willing to accept limits on my freedom, however we want to conceptualize that. And in return, I expect to get some good, that the community will take care of me, that by acting in this way, by committing to quarantine, I am not just sacrificing myself to help others, but I am sacrificing myself to be part of a community from which I benefit by being part of that community. So the community protects and sustains me. Without reciprocity, any form of quarantine has the potential to be truly unethical, in my understanding. And I think in the understanding of the authors as well. So we might think here about how reciprocity is playing out in our current situation. And also think a little bit about the potential connection here to justice. So we're going to be talking a lot about justice next week, but think about how reciprocity might be a form of justice. So the basic conflict here still remains the individual versus community, and autonomy versus policy. So I'm using that language, autonomy versus policy, because I want to draw your attention to two Greek roots at the sort of base of these words. Autonomy, we've talked about this before in class, has auto, which is self, A-U-T-O, and nomos. That's the N-O-M-Y part. Nomos is the ancient Greek word for law or rule. So autos, nomos, autonomy is self-rule. So I'm in charge of myself. I can do it. It's me. I know what I want. I do what I want, right? That's autonomy. And policy, on the other hand, has at its root the word polis, which means city. So it's about the rule of the city and the state, right? Polis, it's the root of politics and policy, and it is about the sort of the larger entity, the entity that is greater than the self, the polis. So me versus the city. That's the basic conflict here. The article ends on the virtue of planning. So if you guys look on page 329, the last sentence, the very last sentence of the piece states that careful attention to the ethical values at stake in public health decision-making can help foster voluntary cooperation and public trust, and should be a part of state and federal pandemic preparedness planning. Okay, so ethical values should be a part of state and federal pandemic preparedness planning. This article was written in 2005, 15 years ago. How well have we done on this preparedness planning? So not in terms of how many ventilators have we stockpiled or how many masks and gloves have we stockpiled. We'll talk a little bit about that next week. But how have we done about incorporating ethical principles into our pandemic preparedness plans? So if you look, for example, at the block quote above this last paragraph, you'll see something that sort of maybe brings this question back to what we were talking about reciprocity. So they write, this is whoever they're quoting, writes, plans should state in advance what backup support will be available to help those who are quarantined. So these are those pandemic preparedness plans should state in advance what backup support will be available, e.g., who will do their shopping, pay the bills, and provide financial support in lieu of lost income. So what they were writing in 2005 is that somebody should have thought about who is going to pay for all this 15 years ago. So the question is, those are real questions that lots and lots of real people are facing right now. Who's going to do the shopping? Who's going to pay the bills? Who will make up for my lost income? So one of the more interesting things this article does, and reading articles about pandemic preparedness planning from the recent past, is make us think about the role of medical ethics in relation to larger questions of public policy and public decision making. So this is back to that idea that we're thinking on a larger scale here. And Foucault is going to ask us to do that too. So we're going to shift to the Foucault chapter now. So what you guys read was the opening pages of the chapter on Panopticism. And to get us there, to think about the transition between Cetron and Landwirth and Foucault, I'm going to direct your attention to the beginning of the first article, the Cetron and Landwirth article, where they give us a sort of amusing historical note about the origins of quarantine. So they note in the beginning of their article that the word quarantine comes in relation to the practice in Venice in the past, They say the 14th century, I think, when the bubonic plague was raging, and ships would be required to stay at anchor, ships coming from ports infected with plague, so places where the Venetians knew there was plague. They would require the ships that were coming to Venice to sit at anchor for 40 days before they could come into the city, before the people could disembark. So that's actually the root of the quarto, and quaranta, in quarantine. It's the Italian word for 40. So they give us this story because it's fun and interesting, but also to draw our attention to quarantine as an ethical dilemma. So they write on 325, the historical association with exile and death, and the morally negative connotation of the sacrifice of a few for the benefit of others remains an undercurrent of public apprehension, that is, public anxiety about quarantine. So Foucault also looks at historical matter from a slightly later period, the 17th century, but about the history of quarantine, to reveal the general workings of political power. So he's asking us to think a bit bigger, I think, than Cetron and Landwirth. So one of the questions I have for you guys in approaching these two texts is, how does this reading look different? How does Foucault's text look different from the article by Cetron and Landwirth? And there are a bunch of surface differences that you guys could point out. So if we were actually in the classroom, I would ask you to name some. But you can see one is an article, one is a book chapter, one is using lots of quotes, and one is not. Foucault uses some quotes, but mostly he uses paraphrase. And one is sort of working by a different standard of argumentation. It has a different tone, a different narrative force. So in order to explain this difference, I'm going to have to do a little bit of a diversion into the history of philosophy. So healthcare ethics, and we can say Cetron and Landwirth's article is an article in the field of healthcare ethics. Healthcare ethics is firmly grounded in the tradition of analytical philosophy. Foucault, on the other hand, comes from the tradition of Continental philosophy. So these are the sort of two dominant philosophical traditions in Western thought, and they're different in their attitude towards the subject. So the continent in Continental philosophy is Europe. So Continental philosophy is primarily practiced, developed by European philosophers, German and French intellectuals in the 18th and 19th century, whereas, and through to the present. And the split really occurs in the 18th century. So Continental philosophy, Germany, France, Europe. Analytical philosophy is England and the United States. American pragmatism comes out of the analytical tradition. And so they're geographically separated, but they're also conceptually separated. So analytical philosophy deals primarily with abstract propositions, formal logic. It is more closely related to math and science in its historical development and in its current practice. Whereas Continental philosophy deals more broadly with language and matter, the material substance of the world. So Continental philosophy is concerned with how language structures our lived experience of the world and all of the things that are in it. How we interact with things in the sort of bigger picture, and it's more deeply associated with critique. So there's an attitudinal difference here. Continental philosophy is critical of the existing structures and norms, much more often than analytical philosophy. though analytical philosophy is critical in different ways. But continental philosophy, so if analytical philosophy is related to math and science, continental philosophy is much more closely related to literature and history. So while Foucault and other continental philosophers have a lot to say about biomedical concerns, and in fact Foucault invents this word biopolitics that people use today sometimes, that refers to the connection between the body and the political, continental philosophers are not typically taught in healthcare ethics courses because the discipline of medical ethics comes out of the tradition of analytical philosophy. So that in part accounts for the difference in tone and style in these two essays. So for our purposes, the question is, how does Foucault think about quarantine differently than Cetron and Landwirth, and what can we gain from analyzing that difference? So what is Foucault's argument here? He starts off, so open your text if you would. Foucault starts off with a long narrative description of a set of plague orders from the end of the 17th century. He gives us a load of details about this quarantine. So it's not abstract ethical concerns, but specifics. How food is provided, who collects the bodies of the dead, who enforces the quarantine, how do they know who's sick, how do they clean the houses, the infected houses, all of the sort of material apparatus of the quarantine measures. He offers us a vision of a perfectly functioning bureaucracy. There are officials in this town, in this plague-infested town, who record and control everything. Not only the movements of people, and not only, they don't just like write down the numbers of deaths and the rates of infection, but they keep track of the minutiae of daily life, of the supply of bread and wine. They build these sort of crazy troughs through which they seem to like pour wine and roll bread into the houses, and they have baskets for hoisting up herbs and fish, and there's all this minutiae, and it's all controlled. So the officials control sanitation procedures, access to medical care and spiritual guidance, access to a confessor. And it's sort of extraordinary vision of an all-encompassing bureaucracy. So it's worth noting that this is not really how plague went down. But Foucault is referring to a real historical document here. So what he's talking about is not so much things as they occurred, but things as government officials wanted them to occur. So he's looking at a 17th century version of those pandemic preparedness plans that Cetron and Landwirth were talking about. So we might think here about the disjuncture between plans and reality in our current moment as well as this historical moment, right? So but what he's talking about is the desire for order, much more than the effects of order. So if you look on page 197, I'm going to read you a kind of long quote because the language is really important here. The style of the argument is conveyed in the language. So on page 197, Foucault writes, "This enclosed, segmented space, observed at every point, in which the individuals are inserted in a fixed place, in which the slightest movements are supervised, in which all events are recorded, in which an uninterrupted work of writing links the center and the periphery." That's that extensive record keeping. They're keeping track of everything. "In which power is exercised without division, according to a continuous hierarchical figure." That is, power is a perfect hierarchy here, in which each individual is constantly located, examined, and distributed among the living beings, the sick and the dead. So everybody knows where everybody is at all times, or at least the figures of power, the intendants and the syndics, the authorities, the public health authorities here, know where everyone is, always, at all times, and all of the details of their condition are recorded, the sick and the dead. All this constitutes a compact model of the disciplinary mechanism. The plague is met by order. So the chaos of contagion is met by the order of the polis, that disciplinary mechanism. So the polis is met by the police. The political dream of the perfectly governed city is what Foucault is talking about here. So disaster preparedness plans encapsulate the political dream of the perfectly governed city. Plague is met by order. Its function is to sort out every possible confusion. This is the continuation of that same quote. Its function is to sort out every possible confusion, that of disease, which is transmitted when bodies are mixed together, and that of evil, which is increased when fear and death overcome prohibitions. So what does he mean there? I think the disease part is pretty clear. The purpose of quarantine is to separate bodies so that they cannot share disease. But that of evil, which is increased when fear and death overcome prohibitions. So I think to understand this, we have to look at a thing he says a little bit later. So if you look, we're on page 197 here, and he talks about a distinction between the literary version of the plague and the political version of the plague. So this is the bottom of the page. He writes, "A whole literary fiction of the festival grew up around the plague." And he's referring to an actual literary tradition here. There are lots of books about plague in this way. And we see this a little bit in films about the end of the world, where there's this idea that everybody's going to go out and have like crazy time and live as if there are no consequences. This is the sort of literary tradition of the plague. So the idea of suspended laws, this is back to 197, suspended laws, lifted prohibitions, the frenzy of passing time, bodies mingling together without respect, individuals unmasked, abandoning their statutory identity and the figure under which they had been recognized, allowing quite a different truth to appear. So the plague in this literary tradition is a time when the normal rules of social order are suspended. They no longer apply. You don't have to go to work anymore during the plague, although of course we do in lots of ways now. So we're not living in that literary dream. So back to Foucault, there was also, bottom 197, top of 198, there was also a political dream of the plague, which was exactly its reverse. Not the collective festival, but strict divisions. Not laws transgressed, but the penetration of regulation into even the smallest details of everyday life through the mediation of the complete hierarchy that assured the capillary functioning of power, that is, power that is so small that it is as small as the capillary veins and arteries. It's the littlest, tiniest intrusion of power onto the tiniest bits of the lives of all of the citizens. So it's not masks taken on and put off, as in the festival, but the assignment to each individual of his true name, his true place, his true body, his true disease. This is the political fantasy of the plague, that it reveals a basic, stable truth. The plague as a form, at once real and imaginary, of disorder, had its medical and political correlative in discipline. Behind the disciplinary mechanisms can be read the haunting memory of contagions, of the plague, of rebellions, of crimes, vagabondage, desertions, people who appear and disappear, who live and die in disorder. So the political fantasy of the plague, this perfectly governed civic order, the disaster preparedness plan, is meant to counter all of these political contagions as well as medical ones. So this is back to the idea that the chaos of contagion is met by the order of the polis. So if we think back to Cetron and Landwirth here, this is where we see the police powers of public health. So back to Foucault again, on 198, the plague-stricken town, traversed through with hierarchy, surveillance, observation, writing, the town immobilized by the functioning of an extensive power that bears in a distinct way over all individual bodies. This is the utopia of the perfectly governed city. So think about that. Is the city under plague the utopia of the perfectly governed city? Is the polis of public health policy the perfectly governed city? So how does Foucault re-articulate the conflict between autonomy and policy? In Cetron and Landwirth, what we saw was a horizontal figure. So we had the idea of the individual versus the community. And the community is what the individual is also a part of, right? So this is what they're trying to evoke is something, like a horizontal figure where I am on the same plane as everybody else and we are all equals. But the distinction between us is that there is one and that there is many. Whereas in Foucault, we get a hierarchical figure. So it's the individual versus authority, right? This is the authority of public order, of the city, of the state, of the officials, of the syndics and the military and all of the police, all of the figures that keep order in civil government. And in relation to that, under the quarantine measures are the individuals who are fixed and immobile and in place, right? And so through this hierarchical figure, traversed through with writing and with all of the sort of complex, detailed measures of the plague, this is how Foucault reimagines this conflict between autonomy and policy. So between individual autonomy, there is this whole sort of complex bureaucracy that is sort of positioning and regulating the individual in relation to this larger idea of policy and order and civil power. So we might ask, and this is maybe a question Foucault wouldn't like us to ask, but since we're reading these two articles together, it's a question we're forced to ask. How does autonomy, the autonomy of the individual, persist within the system of quarantine? That is, what escapes? What escapes this fantasy of political order? So if you guys even look at the very beginning of the sort of the text that he is paraphrasing and referring to, he brings up this idea of the people who do move within the fixed and immobile structures of the quarantine town. So he talks about crows on 195, the people of little substance who carry the sick, bury the dead, clean and do many vile and abject offices. So in our current system, these people are people we call essential service workers. And we don't think of them, or at least we hope we don't think of them, as people of little substance, but they are people who are permitted to move within the system of quarantine and also are subjected to the risk of death at a much greater rate than the people who are fixed in place by the system of quarantine. So quarantine forces immobility on some and movement on others. So there are also, in this system he describes, all of the people who keep the order, right? So they're the people who keep the society running, the essential service workers, the crows. And there are also all the syndics and intendants, the police powers of public health, the people responsible for the surveillance and enforcement of the quarantine. So the question I have for you is, how is the system constituted by that which escapes it? What are the necessary movements within the fixed immobility of the quarantined town? So a bit of summary, and to try to tie these two together. So leave that lingering, and you'll return to it on your worksheet. That's what I want you to think about yourselves. But so the sort of main points that I want you guys to take away from this lecture is the conflict between autonomy and public policy, between the individual and community. So this is articulated in Cetron and Landwirth as an unresolvable ethical dilemma. But Foucault offers a resolution. Foucault resolves this dilemma by the disciplinary mechanisms of political power. So it's not a very nice resolution, but it is a resolution. So the enforcement of quarantine measures tells us that individual autonomy is always already in conflict with political authority. So in a way, he just sort of expands that conflict that Cetron and Landwirth limit to the situation of public health policy under quarantine to be a fundamental conflict of the individual and society. And so what this allows us to do is think about the extraordinary circumstances we are experiencing right now, the extraordinary circumstances of social distancing, as an occasion to examine the ordinary workings of our social order. So Foucault might allow us to see more clearly the conflict between autonomy and authority, between the individual and the community, between me and the city, autos and polis, as a constitutive concern of our lived reality, of the world as we know it. So that's it for this week. I will leave you with big abstract questions. And I will look forward to receiving your worksheets on Friday, April 17th. And as always, if you have questions or concerns, please email me, and I will return this week's worksheets before next Friday. Okay? So take care and be safe.